Our medical senior leader from United, Margaret Mary Wilson, she brought the idea of MCG guidelines in Brazil in the beginning of 2015.
Okay.
It was a challenge to improve efficiency throughout our hospitals, mainly at our owned hospitals. There we own just like almost 30 hospitals in Brazil. And she introduced the idea on May 2015. It took about a couple of months to introduce the use of MCG guidelines throughout our hospitals. Afterwards, we increased the use of MCG guidelines by sending some physicians and case managers of ourselves to contracted hospitals too. Trying to engage owned hospitals and also contract hospitals. Well, that's sure a challenge, but that was not so difficult like people thought, because a lot of physicians and case managers too, they learned English, they have English proficiency, or they understand listening and reading English in a good way. And our literature that we follow usually is in English. JAMA, New England Journal of Medicine, and for us in critical care medicine. So these are journals that we usually follow and read. Before that, we had our KPIs, we had our program and database, but we were much more worried about managing the ICU admissions by themselves. It means that we were worried, me and my colleague Danilo, we were worried much more about ICU length of stay and some protocols, the use of protocols inside the ICUs. Afterwards, we had to engage with the other teams in the hospital, just like emergency room and the physicians in the wards, just like hospitalists and surgeons too. So we try to improve engagement throughout the hospital stay of the patient. So this was such a big difference. And afterwards, we saw that we could increase
efficiency
through some common disease, just like pneumonia, acute myocardial infarction, stroke. And we saw, goal length of stay is so short. Are we able to do it? But after 2 years, we saw that it's necessary to change that. Hospital length of stay during almost 1 year was reduced by 26%, and ICU length of stay was reduced 15%.
That's great.
Yeah. And after we sent our report to the Doyle Award, we made another recent comparison. It continues to decrease by 10%, for example, in the second semester of last year. We track the KPIs throughout 109 hospitals in Brazil, and the mean length of stay continues to decrease without any change in mortality, a slight decrease in mortality, and stable readmission rates, which means we're increasing efficiency.